My name is Shelley Aldridge, and I'm a registered nurse. I currently work at St. Joseph's Medical Center in Stockton, California, in the Cardiac Intensive Care Unit. One of my roles as a nurse is to create a healing environment that will impact the patient's experience, well-being, and recovery. At the end of the course, the learner or student will achieve the following objectives. Apply stress management strategies to the patient who is experiencing stress. Develop an individualized nursing care plan incorporating non-traditional healing strategies. Create a healing environment for the patient as evidenced by a decrease in the patient's vital signs and increased patient and family satisfaction. And be able to state the benefits of creating a healing environment for the patient. Hospitals are moving toward a more patient-centered and holistic care delivery model that takes into consideration the cultural needs and preferences of patients, family members, and staff. I want you to perform this exercise so that you may have a better understanding of the importance the environment plays in healing. I'm going to have you close your eyes right now and don't open them until I tell you. Picture yourself as a patient in the hospital bed. Look around you. What do you see? What do you hear? What do you smell? Now, open your eyes. Do you think this is the optimal environment to heal? This image alone can raise feelings of anxiety and levels of stress. Is this the room you pictured? What about this room? Do you notice the artwork, flowers, light, personal items? When you had your eyes closed, did you see paint color or pictures on the wall, or did you visualize all the machinery, such as IV pumps or the telemetry monitors? Did you see your favorite personal items on the bedside table? Or did you picture the water pitcher or urinal? What about sounds? Did you hear soft, relaxing music, or did you hear voices from the hall, or pumps beeping, or phones ringing? Did your room have windows? Were the curtains open? What was your view out the window? Where I work, there are rooms with a view to the cemetery. The concept of environmental influences on healing has been known since Florence Nightingale, a nursing leader who cared for soldiers of the Crimean War. She said, "The goal of nursing is to put the patient in the best condition for nature to act upon him." She was born May 12, 1820, and was the first nursing theorist. She explained her environmental theory in her famous book, Notes on Nursing: What It Is Not. One assumption of her theory is that nursing is achieved through environmental alteration. Her major concepts included want of fresh air and light or warmth, want of quiet, cleanliness of rooms and walls, personal cleanliness, chattering hopes and advices, and the want of punctuality and care in the administration of diet. She realized that poor or difficult environments led to poor health and disease. She said, environment could be altered to improve conditions so that the natural laws would allow healing to occur. We perceive our environment through our five senses: sight, smell, touch, taste, and hearing. The information we pick up from our senses is relayed to the brain, which in turn will affect our physiological, emotional, psychological, and ultimately physical condition. The impact of stress on a human body cannot be underestimated. I will review the effects of stress on the individual body systems in the next slides. Musculoskeletal system. When the body is stressed, muscles tense up. With sudden onset stress, the muscles tense up all at once, and then release their tension when the stress passes. Both tension-type headaches and migraines are associated with chronic muscle tension in the area of the shoulders, neck, and head. Respiratory system. Stress can make you breathe harder, and for those with asthma or lung disease, Getting the oxygen they need to breathe easier can be difficult. Stress can also cause hyperventilation, which can bring on a panic attack. Cardiovascular system. Stress can cause an increase in heart rate and blood pressure. It also appears that how a person responds to stress can affect cholesterol levels. Endocrine. When the body is stressed, epinephrine or cortisol is released by the adrenal glands and can cause an increase in the heart rate and blood pressure. Liver. When cortisol and epinephrine is released, the liver produces more glucose. To type 2 diabetics, this extra blood sugar can mean diabetics requiring insulin. Gastrointestinal. Stress or exhaustion can increase the severity of heartburn pain. When you're stressed, you may eat much more or much less than you usually do. Stress can affect digestion and what nutrients your intestines absorb. It can also affect how fast food moves through your body. You may find that you have constipation or diarrhea. The immune system. When stress affects the immune system, the body can become more vulnerable to infection. Psychological stress leads to clinically relevant delays in wound healing. Creating a healing environment. The word healing comes from the Anglo-Saxon word helen, which means to make whole. In a healing environment, the nurse is recognized within the healthcare setting as the professional with the potential for the greatest impact in creating this environment. As I walk down the halls of the hospital, I look at the faces of the patients and realize that each one of them has a unique need to heal. Whether from a physical problem or a psychological crisis, healing encompasses a process involving much more than the delivery of medications and procedures. It is a process which includes our physical body, consciousness, and soul. It is our role as nurses to create this healing environment that will impact the patient's experience, well-being, and recovery. Noise level. Noise is one of the most common stressors. In any patient room or unit, noxious noises can be the hum of medical equipment, bubbling of chest tubes or oxygen humidifiers, staff conversations, pager and intercom systems, ringing of telephones, opening and closing of doors, cabinets, and supply carts. Noise has been identified as a highly negative environmental characteristic. It increases patients' perceptions of pain and increases the use of pain medication, contributes to sleep deprivation, and causes confusion and disorientation among some patients. Florence Nightingale said, "Unnecessary noise, or noise that creates an expectation in the mind, is that which hurts a patient. Of one thing you may be certain, that anything which wakes a patient suddenly out of his sleep will invariably put him into a state of greater excitement. Never allow a patient to be waked, intentionally or accidentally, is a sign of all good nursing. Such unnecessary noise has undoubtedly induced or aggravated delirium in many cases." She writes, "The patient craves for the return of the day and desires light. Little as we know about the way in which we are affected by form, color, and light, we do know this, that they have an actual physical effect. Variety of form and brilliancy of color in the objects presented to patients are actual means of recovery. It is important to create a healing environment by providing views to the outside, by making sure the curtains are open. If possible, take the patients to any of the hospital's healing or therapeutic gardens or aquariums." One can enhance the environment by using the elements of nature and creating a pleasant view with artwork. Artwork should produce a restful, calm feeling for patients and families. Put together an art cart where inpatients may pick artwork for their room from a selection of local photography. In our hospital, no one is allowed to visit under 16 years old. I encourage the kids or grandkids to draw a picture or make a get well soon card that can be hung in the room. Artwork can be used as a positive diversion. Encourage family members to bring flowers. Florence Nightingale even said, "I remember when a nosegay of wildflowers being sent me, and from that moment recovery becoming more rapid." Odor. There is some evidence that pleasant aromas lower patient anxiety in specific settings, and negative smells or odors have been observed to stimulate anxiety, fear, and stress. Remove offensive odors from the immediate environment as quickly as possible and provide other, more pleasant odors to supersede the noxious ones, such as vanilla, lavender, and mint. Information received through our five senses evokes physiological and emotional responses of anxiety or serenity. Even Florence wrote, "I know an intelligent, humane house surgeon who makes a practice of keeping ward windows open." Variety. Florence Nightingale wrote, "To any but an old nurse or an old patient, the degree would be quite inconceivable to which the nerves of the sick suffer from seeing the same walls, the same ceiling, the same surroundings during a long confinement to one or two rooms. This is why, as a nurse, you need to encourage family to bring in pictures of their loved ones, favorite personal items, books, magazines, their iPad, iPhone, laptop, music, or DVDs." Visitors. Creating physical environments that support families and patients' psychological well-being can produce a positive impact on therapeutic outcomes, reduce stressors, and improve staff performance and morale. You can start by liberalizing family visitation. Family members can provide the spiritual and emotional support to patients in an unfamiliar situation, and they can help give meaning and understanding of the experience of illness for the patient. Hospitals can promote social support by providing waiting rooms and lounges with comfortable furniture. Provide amenities that make it easier for family members to stay overnight, like get them a pillow, blanket, or recliner. Let them know it's okay to have a small ice chest in the room for their food and offer to get them ice. If family stays, then there's less restraint use, and they question the MDs, so they stay informed and they are less stressed, which relieves the patient too. All hospitals have an interpreter service, so make sure to utilize the system to communicate. Make sure to identify any religious or cultural practices that you should be aware of. The general nursing literature reported several studies of healing modalities as part of the creation of a healing environment. These non-traditional healing modalities include hypnosis, guided imagery, therapeutic touch, yoga, Reiki, aromatherapy, spirituality and prayers, relaxation techniques and massages, acupuncture, acupressure, and reflexology. We have pet therapy at my hospital, and at the end of the presentation, I have included an impromptu interview that I did with our pet therapy team. As you will see, the dogs are well trained to all the noises in the hospital environment. When doors are opening and closing, they aren't even moving. But the point also is that there is a lot of noise in the hospital, and this does not create a healing environment. Design. Moving furniture such as bedside tables and the bedside dresser out of the way so the patient can maneuver around these objects easily to enhance their sense of independence. Place controls for nurse, lighting, telephone, TV, and radio within easy reach of the patient to enhance self-reliance and increase patient safety. Having a patient in a private room will reduce infection rates and also allows for a patient to speak more freely with the caregiver when discussing private matters. Offer the patient choices and options. Giving patients a sense of control can significantly reduce stress. Allow them to select where they would like to sit and control timing of their meals. Florence Nightingale said, "I have known a patient's life saved by the simple question put to him by the doctor, 'But is there no hour when you feel you could eat?' The thing was tried and succeeded." Keep patient informed. Always keep your patient informed to help reduce stress and anxiety. Nightingale said, "Apprehension, uncertainty, waiting, expectation, fear of surprise do a patient more harm than any exertion. For the same reasons, always tell a patient and tell him beforehand when you're going and when you will be back." In summary, the use of healing spaces which incorporate nature, color, light, music, art, aroma, and design is a care construct in healing environments. Benefits of a healing environment. Incorporating elements that produce a healing environment is not only good for patients, but also a good business strategy for healthcare providers to sustain or gain a competitive edge. By creating a healing environment, healthcare providers will see a decreased length in stay, improved patient outcomes, fewer cases of infection, increased family and staff satisfaction, decreased staff turnover, and decreased stress level among staff. I've created a poster to be hung in the patient rooms and the patient care visiting areas. Tips for creating a healing environment: institute quiet hours after 9 p.m., and suggested items to bring: favorite personal items, music, flowers, pictures of loved ones including their pets, books, magazines, crossword puzzles, even their iPads or iPhones, drawing pad, stationery, colored pencils.
So we're working on creating a healing environment at St. Joseph's Medical Center, and as part of the healing environment, we're instituting pet therapy. You want to introduce yourselves, ladies, and your pets?
Sure, I'm Dee Dee, and my canine is Dante.
And I'm Sandy, and my canine is Zeus.
And St. Joseph's, I'm the actual program coordinator for the therapy dogs, and we're working on doing stellar obedience with excellent socialization, which means that the dogs can handle any kind of environment, from loud to people with disabilities, children. Dropping a bedpan next to them, they won't spin around and yank out an IV pole. But they uniquely seek out the affection of strangers, no matter what type of person that might be. And we've had experiences where we've had a lady attached to a stress monitor, and we watched her numbers go down as she started to pet a dog. We almost always get laughter. We will have nurses tell us that they haven't seen their patient laugh and smile in days, and it's a really phenomenal event to watch the dogs interact, and they know when somebody's ill, and they take special care of them.
Okay, great. Thank you so very much.
You're welcome.